You guys are the brave and bold and very innovative folks that are here for the ketamine panel. So props to you. You know, those of us who work in the ketamine industry, we think like everyone knows about ketamine and like everybody's talking about ketamine all day long, but look at it, like we're really early, you guys. So, you know, if you're here, you're working in this field or you're interested in it, congratulations for being on the leading edge. Because this is really the new frontier of treatment for mental health. And although some of us, you know, may think everybody knows this, there's still a lot of work to do to educate people. So I'm really honored today to be here with these incredible experts on ketamine. And I'm glad this is being filmed. So, you know, we can share this information more widely. Those of you who are here are going to have an opportunity to ask some questions. And I just want to start with some introductions. So I'm Kaya Roman, and I wrote a best-selling book called The Joy Plan, which is about the neuroscience of joy. And I wrote this book like 8 years ago now, before I ever had a psychedelic experience. And my whole point was all about neuroplasticity and how to create new neural pathways and how to change the habits of your mind that get you stuck into, you know, depression and anxiety from my own perspective, trying to find joy for myself. And then I had a psychedelic experience and I was like, wait a minute, don't read my book. Go have a psychedelic experience, create some new actual neuroplasticity in your brain, and then form these new neural pathways. And I learned about ketamine. And, you know, ketamine is legal, it's a very easy, gentle experience, it's very accessible compared to other psychedelics that you might have to travel to another country to do. You know, things are changing all the time, but at the moment, ketamine is the most accessible. And so I was able to co-found a company called KetaMD, which is an at-home ketamine treatment company where we offer ketamine treatments at home, guided over telemedicine by registered nurses. And our goal really is to bring this medicine to as many people as possible. So I'm very passionate about ketamine. I've personally sat with over 300 people and seen this like incredible transformation that this medicine brings to people who are suffering. So I'm also the vice president at a company called Psychotherapy Bioscience that is working on a patented formula for topical ketamine for PTSD. And I just think this molecule, there's just so much potential here that we're only just beginning to learn about. So like I said, I'm really excited to tap into the experts here today, and let me introduce them to you. So first we have here our, in the middle, Dr. Austin Harris. He is a cardiothoracic anesthesiologist with a background in psychology. After 10 years in private anesthesia practice and seeing the profound benefits of ketamine as a tool for assisting in mental health, chronic pain, and substance abuse recovery, Dr. Harris transitioned from the operating room to independently perfect these techniques in a mobile fashion at medical offices across Southern California. Dr. Harris then formed Neuro-Relief Ketamine and Infusion Therapy, which you can find in Sherman Oaks, to bring these successful results to the entire patient population. This much-needed service, in addition to other infusion types and holistic and alternative healing strategies, is now benefiting thousands of clients across the world. So thank you, Dr. Harris, for being here.
It's a pleasure.
We also have Dr. Tracy Covington, who has a doctorate in clinical psychology and is extensively trained in developmental trauma disorder, PTSD, anxiety, panic, depression, as well as everyday life transitions. She has specialty training in consciousness and mindfulness and offers services in psychedelic-assisted therapy, also referred to as ketamine-assisted psychotherapy. Dr. Covington is a clinical psychologist in Redland, California, that has been in practice for over 25 years. She specializes in mindfulness psychotherapy and offers a multitude of services for depression, anxiety, PTSD, and other psychological challenges, as well as biofeedback and neurofeedback. Thank you so much for being here. I love how varied the experts are on our panel. And then we have Dr. Joy Kong. She is a UCLA-trained, triple board-certified physician in the fields of psychiatry, addiction medicine, and anti-aging and regenerative medicine. She is the medical director of Uplift Longevity Center in Los Angeles, where she utilizes cutting-edge and innovative technologies such as stem cell therapy, peptide therapy, ozone therapy, and ketamine therapy to help her patients. Dr. Kong believes that true healing can only be accompanied by addressing both the body and the mind. She was named Top Doctor of the Year in Stem Cell Therapy 2019 and Stem Cell Doctor of the Decade in 2021 by the International Association of Top Professionals in recognition of her contribution to the stem cell field. Dr. Kong's memoir, Tiger of Beijing, was named 2020 Book of the Year and showcased at Times Square. Dr. Kong is an avid educator, a sought-after speaker at scientific conferences, and founded the American Academy of Integrated Cell Therapy, where she provides training to other physicians on stem cell therapy. So, amazing panelists, let's get into it. I'm so excited to hear from you. So I want to start with Dr. Harris.
Excuse me.
Oh.
Can you get a little closer to the mic?
Oh, yes. Ooh, wow, that's a big difference. Sorry. Okay, so I want to start with Dr. Harris. I know a number of anesthesiologists who ended up opening ketamine clinics, and I find this fascinating that you are seeing something in your practice of anesthesiology. For those of you who don't know, ketamine is one of the most common anesthetics given in surgery around the world. And so you're seeing something that your patients are experiencing with ketamine, and obviously that led you to decide to work with ketamine for mental health. So I'm really curious if you could tell us at the neurological level, how do you believe that ketamine is able to have the positive effects that it's having? Like, what's happening to these people when they're having ketamine?
That's a fabulous question. So basically, ketamine is, since it's been around for over 60 years now. This is before we saw sort of the pharmaceutical lobby going for the one receptor, one medication approach. We had medications like ketamine, which was invented in 1962 actually by the US military to treat field trauma in Vietnam. And then based on its high safety profile and incredible efficacy became the most popular anesthetic in the world for decades. So it actually works on 7 different receptors. And in order to bring that together as sort of more of a singular concept, we can look at it as the monitoring of neurologic function and efficacy, and then when there's the need for change or adaptation or repair, the mechanisms that then go in at the molecular level and either repair, reroute, detour, or repattern how the actual infrastructure of the neurologic signals are being transmitted. So when we think about a lot of other medications, like whether it's antidepressants or anti-anxiety medications for mood or pain medications for pain, we're looking at singular receptors that are sort of almost pulling a trick on the body. When we look at ketamine, we're looking at actual structural repair. So the actual pathways themselves, the way that the infrastructure looks at the synaptic level, both on the pre and post-synaptic sides. And when we think about ketamine, let's start, for example, just with the mood indications. We think about 4 major categories. The first would be when ketamine binds to AMPA receptors, it stimulates the nerve cells' production of what's called brain-derived neurotrophic factor. And we see this being discussed in other psychedelics as well, but it's certainly most popularized and understood in ketamine. And BDNF, as we say, is think of the Los Angeles Traffic Control Center. It is the way that the nervous system, the central nervous system especially, is monitoring what the structure is doing. And then when it sees an area of, let's say, disrepair or dysfunction, it sends out or recruits the resources and the workforce to go in there and actually do that fixing. We talk about synaptogenesis, or the actual rebuilding of the structure of nerve synapses, And when you rebuild that structure, you regain function. The second we would look at is NMDA receptor antagonism. And this is something that also is often stated. But what is less understood is exactly what happens next. So if you think about our nervous system as sort of always in a balance between either a fight or flight mode or sort of a resting, relaxing mode. And our body, in terms of its homeostasis, is designed to counterbalance both ways. So, when you're running away from the lion, you need everything right now. When that need has passed, we need to be able to calm down. So there's a network of, vast network of inhibiting interneurons called GABA neurons. And GABA is a global inhibitor of activation synapses. So it's sort of, whoa, everybody, calm down, it's okay, try to soothe. Certainly in the short term, that's what we want. However, what we see in mood disorders, depression, anxiety, PTSD, bipolar, postpartum depression, etc., is that this isn't just a collection of symptoms with a name and an ICD-10 diagnosis code. It's actually a neurophysiologic state that our brains are being exposed to, and that exposure has a neurologic detriment. And we see this structurally. We see the dendrites of nerve synapses actually start to wither and retract, okay? This is being done because that sort of calm down mechanism, that GABA mechanism, has been trying to calm down the stress response for a long time. Over time, that sort of attempt to self-soothe, which is only designed really to be a short-term mechanism, turns into an atrophy signal. So you actually see structural deterioration as a result of this long-term inhibition. The NMDA receptor is a receptor that's on that GABA interneuron. So when you turn that receptor off, you turn the GABA off, you're turning the off. And so what you get then is a default on situation again, where now in combination with increased BDNF production, which is a marker of neuroplasticity, and other factors that are occurring concurrently, now you actually have a situation where the weight or the inhibition has been lifted, and now you have the resources to actually do that structural repair. And there are other factors. There are increased sensitization or the lowering of thresholds for voltage-gated calcium channels, which are involved in the actual depolarization of the synapse. You want them to fire more and more often, which gives us a greater sense of bang for our buck in terms of the reward we're getting from, healthy, beautiful daily stimuli that are around us in the millions every day. But if we're not really getting sort of the juice for the squeeze in terms of that relationship, we see that as a big factor in mood disorders. And finally, the overall global neuroplasticity, which BDNF is a marker of. We see that as a neurologic benefit of ketamine, but also an opportunity, and one that we want to actually utilize to retrain, reprogram, and remodel both at the conscious and unconscious level. And that's why we'll be discussing more the integration strategies, CBT, mindfulness, etc.
Wow, amazing. Thank you so much. I feel like you just explained how ketamine works in a way that I've never heard before. So that was really, really helpful. And it just makes me think, who couldn't benefit from that? I mean, I know ketamine is prescribed for people who are dealing with, treatment-resistant depression and PTSD in really acute situations. But at this point in human existence, who isn't going to benefit from that?
And especially since we now know after a 60-year safety profile that this really can't hurt you.
Yeah.
There's no downside.
So my question is, this question is for Dr. Covington. So if, say, everybody's brain could benefit from ketamine, there is a little bit of, controversy, or just people have different opinions about this, about whether, ketamine is best given alongside psychotherapy, the ketamine-assisted psychotherapy. Or is it, what is your opinion? Is it just like get ketamine into people's bodies no matter what? Or is the therapy component a really important part of it as well?
So, first of all, ketamine-assisted psychotherapy, the way that I would refer to it is something done synchronously with ketamine treatment. Some do it post-treatment, but what I'm going to refer to is done synchronously. And yes, I have come from the belief that it actually is the gold standard. And I find that absolutely, and you can understand from what just Dr. Harris said, that ketamine alone is a huge benefit for the regenerative processes and the healing processes. But when we really understand there's another level of psychology that is going on, I would like to just give a quick quote from Raquel Bennett and the Cry Institute. And she states that psychedelics are relational medicines. They're visionary medicines, and they are relational medicines. And when we understand, when we're talking about PTSD, depression, anxiety, that we are wounded in relationship, thus healing is done in relationship. And to optimize this, that when we sit with a patient as a psychological interpreter, that we offer another level of a deeper healing. And that those symptoms certainly can be treated and mitigated with ketamine, but that the underlying mental health wounds and potential for symptoms to reoccur perhaps will remain until those relational wounds on that psychological level. So in the ketamine-assisted psychotherapy, as I offer the time to sit with that patient, there's several levels that go on. First of all, there's two types of experiences. One is a psycholytic experience, which is a lower dose of ketamine. And this is where the patient is perhaps less in their inward journey. So they can do a little more expression, a little more, they might talk a little bit more. There might be more of an exchange. And in my consultation with people, I have an extensive background in personality styles and temperaments. So I've already kind of figured out whether they're introverted or extroverted thinkers or feelers. And so I'm approaching them on that. You'll find that the introverts, of course, have a little bit more quiet inward journey. Extroverts, a little bit more chatty. The thinkers tend to go, again, more inward. And so I'm cueing them maybe a little differently. I'm asking what their experience is, drawing them out. And these are shifts in their psychology. The extroverts and the feelers tend to, again, express a lot more. I'm meeting them where they're at, and then, again, cueing them, giving them opportunity, telling them that there's an availability to go deeper, explore more, whatever they're sharing. Symbols, geometry they're seeing. Sometimes, I'll explain this in my talk later, they might get stuck in a place that they get kind of upset with. I don't want to be this black box again. There's my mother's wallpaper. I don't like that. These are very important things to explore, and without somebody being that psychological interpreter for them, those valuable pieces of wealthy information get missed. And when we try to get them to process that, if there's nobody there to catch that with the psychological interpretation, that often is missed because they may not remember that post-treatment, especially when you get the second level of treatment. It's more of a higher dose of ketamine. You get a psychedelic experience, and there's an amnestic effect. So again, I've had profound experiences in a psychedelic level of dosing because, again, you might see body movement. They might curl up, they might expand, they might cry out for help and reassurance. That might be coded with something that some one word or one image that comes up. And again, that becomes very meaningful in the post. Then I'm describing pretty much everything they're saying, and then that gets processed post in that very as they land, that soft, spongy space that they come out of, and that gets processed right then. So I think so much gets left on the table or in that session if there isn't a psychological interpreter that is qualified to deal with the psychological spillage or the psychological spiritual spillage, and somebody that's really qualified to know how to deal with someone in a non-ordinary state of consciousness. One other thing I just want to say after doing 30 years of psychotherapy, that it was so monumental to see the process, the quantum force that people go through with their ketamine treatment, the energy of unraveling, unfolding, opening. I have witnessed people going their series of 6 and doing work and depth and experience that equates to what people have done in 6 years of psychotherapy. This is mind-blowing. And the other thing I would just add is that I don't believe there's any bad trips. When I started my studies and looking at some of the back, I forget what they're called, chat boards of patients that were just doing IV alone, there's a lot of them out there that are talking about, I had a really bad trip and I asked them, they're probably not called really, perhaps all ketamine clinics are not equal. They're not probably all levels of treatment like Dr. Harris here, but they were talking about having bad trips and feeling like they wanted to understand more what happened to them, and there was nobody there to help them understand that. So with a ketamine-assisted psychotherapy process, there are no bad trips. If they have a panic attack in that, that's meaningful to work through. It's a powerful session. If they have these difficult images or repeated themes, as I said, that are frustrating, this becomes meaningful information of what they're tethered to, what's blocking them. And I think the other thing to say is that we often say you have that inner knowing to tap into, but when you've had mental health issues for a long time, you don't know how to tap into that. And when you start tapping into that, you don't know what to do with it. So again, to have that psychological interpreter becomes powerful to add that whole other level so that the likelihood of recurring symptoms or further issues, we are, I think, advancing and lessening that possibility.
Thank you. Thank you so much. Amazing. I'm so excited to, have this combination of people here, because I think what we're all doing, and we are all really early in this, is trying to figure out what is the ideal experience that we can create for our clients or our patients, right? And so for you, Dr. Covington, you're really finding, like sitting with them during the experience and providing that layer of psychological support. And I'd like to hear from you, what you do in your clinic, because I know it's really unique. And with KetaMD, we've created an at-home situation for people that just are depressed and it's hard to leave their home. So we're having them guided by nurses over telemedicine. And Dr. Kong, I'd love to hear from you about, what you're doing in your clinic. And I find it really fascinating that you are fitting ketamine into your whole sphere of anti-aging and regenerative medicine. So I'd love to hear from you, how do you think ketamine fits into wellness for what you provide for your patients?
Okay, thank you. So I was trained as a psychiatrist, and then I was board certified also in addiction medicine. And that's when I realized the limitations of the mental health approach and how it's not addressing the root causes. And that's how I got into the whole anti-aging field. So if we can prevent aging decline, then we can prevent a lot of illnesses, including mental health illnesses. So I became very inspired by stem cell therapy. But there are still limitations of stem cell therapy. I think we're addressing a lot of the physical aspects of our existence. So I think there are different levels of existence for us. The physical aspect, utilizing the origin of life, we can definitely help regenerate and repair damaged tissue. But what is going on in the brain and what's happening with the mind? And why are we trapped in traumatic experiences? Why are we trapped in maladaptive patterns? And that I was not able to heal with stem cell therapy. And that's when, of course, I'm going to talk about it in my own presentation about my own personal journey, searching for healing, for more complete wellness. That's when I got interested in ketamine therapy. Actually, Dr. Harris was the one that gave me the first 6 sessions, which was a mind-blowing experience. That's the least I can say. It's just absolutely astounding. I'm actually able to change people's brain connections not just brain cells themselves, but connection, how the cells talk to each other and how they process information and how they can possibly go beyond their experiences and regroup the connections. So that is very, very almost mysterious kind of achievement. And I'm still puzzled. I don't understand it yet because I think there's so much that we don't understand in the world of science and just human existence. So when I brought it in initially, I was brought in the clinic. It was kind of inspired by my own attempt to heal my own traumatic brain injury I'll talk about in the presentation that I didn't know I had. So in the process of trying to heal my own brain, I was incorporating it with different modalities. So I was doing it, I was working very hard to try to heal my brain in 2 months, knowing what ketamine can do, but with all the other tools I have. So I started incorporating it with different modalities like light therapy, including infrared sauna, including light helmet, including inversion table, including other a couple of other things. So I just found that to be so powerful, and I'll show you what happened with my brain scan in 2 months. So that's when I realized, okay, I'm getting a completely different experience with these different modalities, and this is tremendous. You become very energy sensitive when you're under ketamine, so you are able to perceive different modalities, and you will sense a difference in energy levels from all these other treatments. So that's what I'm bringing into the clinic. I'm about healing the mind, but I also want to rejuvenate their body at the same time, and I want different things to come together because I do believe we're energy beings. And if you asked me 6 years ago, I would think that would be ludicrous. I would ever say that, but now I know because I've seen it. So seeing is believing. So now understanding who we really are and how our body is functioning, possibly in so many dimensions, and then addressing it from different aspects is very helpful. So psychotherapy is fantastic, or even possibly past life regression, but there's so much we don't know about human existence. And so if I can incorporate more modalities, energizing the system while the ketamine is working, is doing its magic, then I feel like I can have a synergistic benefit. So that's kind of what I'm bringing into my clinic.
Thank you so much. So Dr. Harris, that's amazing to hear that Dr. Kong actually had her first treatments at your clinic. And I was reading actually that your clinic's success rate is, a success rate, which I'd like to know how you measure what's a success rate, but I was reading that it was 85%, which is a little high. I mean, ketamine is pretty remarkable. I think that generally the success rate is around 70%. But I'd love to know, how do you guys define success, and what are you doing that you think is creating remarkable experiences and maybe different from what Dr. Cullington is doing that is creating a high success rate for your patients?
Thank you. I think that when we approach any field of medicine, but certainly one that I would say is sort of the new kid on the block, it's really important that we're approaching it from a very practical standpoint, a very scientific standpoint. And, thankfully, ketamine having been legal for over 60 years now, you have hundreds, if not thousands of, double-blind placebo-controlled trials that demonstrates not just that a molecule might be helpful for some people, but that it is how to optimize that, how to adjust that, how to address different issues with different people in different ways. That takes time. It takes a lot of time. In terms of making sure to see how we're doing and what things we're doing are working better and for different people. So we use a third-party outcome tracking called Outcome MD. And what we utilize is NIH objective surveys and assessments. And then a lot of those have been customized for our particular purpose. And then we're setting a baseline before someone even really comes in to meet with us for the first time. So true pre-treatment baselines. And then through a diversity of re-questioning every couple of days over the course of their program, and then also following up and seeing, how does that last? And I think that's a very important thing that needs more discussion, is not just benefit, but longevity of benefit. And so we have a completely hands-off approach to what happens to that data. It's all a third party that actually works with a whole lot of different fields. So we see that 85%, and there's actually a definition for medical success. And that is a 50% or greater improvement from baseline symptoms. And that's not field specific, that's across all of medicine. So that's an important metric to understand when people say, I had a successful result. It's at least 50% or greater improvement in baseline symptoms, which means you need to know what those baseline symptoms are and be able to stratify and standardize what the improvement would look like. Why do I think we have a significantly higher outcome success rate than what I would say is the industry average? I think that's because, and this is something I would like to see change as a field, that I think that there's still, the vast majority are sort of like, here's some ketamine. It's a fairly standardized weight-based dose for pretty much everybody. And then it's just sort of like, okay, good luck. And I think that, like Dr. Carpenter was saying, that would leave so much on the table. There's so much more that we can accomplish from this opportunity, not just the neurologic shift, but also, working on the psychological level, the personality level. We say neurology is the nuts, the bolts, the wires. Psychology is sort of the relationship with ourselves, and personality be the relationship between whatever we think we are and everything else. These are all categories that we want to try to help a person not just experience a short-term benefit or that was an interesting experience, but utilize the opportunity of this new neurology, utilize the opportunity of being able to transcend actually the walls of their own personality traits, their own defense mechanisms, many of which may have been ingrained since before they can remember. And only through this modality have they actually be able to see and feel what the other side of that wall feels like and realize that it's not a threat to them. That's an incredible paradigm shift that we want to actually take the advantage to use that, to actually, neuroplasticity is a potential. It doesn't just go presto, I know exactly what I'm supposed to do. It's we, and through how we're processing and focusing, how we address and choose which data we're going to invest our bandwidth in as we're going through the day, our thought patterns, our choices. This is what tells our brain which roads to develop. And so at our clinic, we start with an understanding that every single patient, it has to be unique, not just from a marketing standpoint, but from a clinical standpoint and a practice. So our approach is more of a concierge one. It's not a volume model. We see fewer clients, and we're spending an incredible amount of time with each one. So that starts with almost a usually 2-hour intake, one-on-one, where we're going through, not just height and weight, and yes, you have depression, but current life structure, relationship structure, the activities that they still feel reward from, that which triggers them, past life experiences, and not trying to be Sigmund Freud here, but the patterns are very helpful in understanding what's the best approach to optimize the outcome and to optimize the relationship that you're trying to develop with this client. And as someone who, Dr. Kong was talking about how sometimes it's our personal journeys, and that's similar for myself. I kind of survived a very difficult upbringing, and had all those defense mechanisms, all of those struggles that we now are seeing a lot of, and understanding what that path looked like. I also understood that it's not a quick fix. It's something we want to have an opportunity. It's a door to open, and then we want to walk through it. We want to know how to do that. So every single client in our program has 24/7 direct access to me personally via phone, text, email. So they actually have a personal guide, someone who's been through this, has done this, who understands where they're coming from and what stages they're at. And it gives them framework and support and guidance when they need it, when they're at those crossroads. And it's like, should I go to the left, which is what I've always done? Or what is this path to the right? What does that look like? Can I do that? What might the outcome be at the end of that path? And so that's a part of our practice. We also incorporate cognitive behavioral technique exercises, or it's more mindful CBT, I would say. And then pure mindfulness with a catered list of meditations and exercises, and they have a daily program that they're doing, and they're onboarded and trained on how to do that and why. And then we follow up and see how that's going for them on a daily basis. And then in addition to that, every single one of our ketamine infusion protocols, whether that is for the mood indications, for the chronic pain indications, or for substance and alcohol abuse recovery, is completely integrated with 5 3-hours that are always included with our certified integration and recovery coaches. And that's where the clients are actually learning how to invest these experiences and that new neurology into the strategic or practical application of that in daily life. And I think tying this all together, as Dr. Covington was also saying, and Joy mentioned, the mind and the body, the whole person, is an absolutely vital approach when we're looking not just to see some benefit, but to optimize and take every last ounce of that benefit that we can.
Okay, amazing. Sorry, they're rushing us to move on, but thank you, amazing. Before we move to Q&A, which they want us to do, I just would love to hear from you, Dr. Covington, and you, Dr. Kong. If someone came to your clinic, what would they experience? Because it sounds like you each create a rather unique experience. Like if I came to your clinic and I'm having my ketamine, am I talking to you while I'm on my ketamine journey? Or just describe that a little bit more. I feel like we got a good sense of what you do, and I'd love to get a sense of what you both do, and then we'll turn it over to questions.
So once they've gone through their consultations,
Yeah.
So yes, they're going to show up, and we're going to put them in a beautiful room. You sit in a recliner, it's low lighting. We use a lightweight weighted blanket and ice shades, and I play amazing trance music. And I'm sitting at their feet, and I often, I ask permission for physical grounding. It's interesting when I forget to do that or start after a couple sessions, they actually request it. It's almost like people feel that light pressure near their ankle as just kind of that sense of, if I turn into a molecule, I won't float away completely. And a lot of cueing, I am speaking to them again at the psychedelic level. There is a lot of engaging. Again, my feelers they're the ones that are like, wow, and it's amazing, and I'm feeling, and so there's a lot of engaging in that. I'm often asking them to explore these different things. We've set an intention at the beginning, also in their prep work. We're being very specific about what this exploration is going to be about, what their specific needs are. And then as we're going through the sessions, we've met as a team to decide what, usually the starting dose recommended is a 0.5 milligrams per kilogram. Sometimes if they've never had a psychedelic experience or they have a lot of other things going on, there are a lot, we might start at a little bit lower dose, and then we're moving them up to a certain threshold based on what's being presented at the end of their series. And I would say that these are cumulative. The sessions are cumulative. They build on each other. I notice that usually at the third or fourth session, there are really major breakthroughs. There are great leaps at that point that are catalytic for the rest of those 2 sessions. And then at that point, based on what's being presented, we use an app for their daily mood ratings and some PHQ-9s and some other tests based on their diagnosis, and then they communicate with us through that app pretty much on a journaling or a daily basis interaction. And then boosters will be recommended based on whether the status of where they're at that point and what we need as a team.
Okay.
Just to say it very quickly, I'm sorry.
No, that's amazing. Thank you. It's so helpful to hear. And how about you, Dr. Kong? If somebody comes and they're looking for, like overall wellness, I have heard you speak about like a combination of body work and ketamine and regenerative like biohacking tools. So what would somebody experience if they came to your clinic and ketamine was a part of their protocol?
Yeah, so a person can either come in just for ketamine treatment if they have certain mental health issues or they have chronic pain. But some patients come to me just for anti-aging, or even neurological repair. I may incorporate a ketamine session right before a stem cell session, stem cell exosomes, and often peptides added, because there are quite a few very powerful neural repair peptides. So I would incorporate that. I think it's a perfect priming when you are using ketamine to enhance the brain-derived neurotrophic factor. And then the stem cells can do something similar. I think you get amplifying effect. Of course, the cells are attracted and more activated by these signals, and they can release further growth factors and to amplify the brain regeneration. And for people coming in for mental health issues, we focus more on the ketamine, but I would also offer them to take some of these powerful peptides to, as an adjunct, because you want, we're getting into ketamine because we want the signals from the ketamine. But what if we give other signals? Because body is very complex. We have over 300,000 peptides in our body floating around, and we've discovered about 7,000 of them. So if I can use some specific signals so your body can give just the right amount of stimulation, especially for the brain, for the neurons, and then I can amplify the benefit. So I want to incorporate that and offer that to them. And so first session, always we're going to do intravenous, because that's just where I will start. So we understand how the person handles ketamine. If they're comfortable, it's much easier to adjust and pause and speed up. We can do a lot of monitoring. But after that, if the person is comfortable, we can utilize intramuscular injections and combine that with all these other really cool modalities, depending on what their needs may be. If they're focused more on brain repair, we'll use a light helmet. If they want full body rejuvenation, we have a full body, a PMF mat, red light and facial rejuvenation. We can do the infrared sauna that can combine detoxification with the ketamine treatment. So depending on what their needs may be, so it becomes really, really fun for the patients. They can rotate their experiences. Yeah, so that's kind of what we do.
Okay, amazing. I look forward to being a client at each one of your clinics and testing it all out. It sounds incredible. So I'm sure you guys have some questions. I will do my best to take the questions and figure out who can take them best. Yes, you.
Well, I wanted to know if what is ketamine? Is it a synthetic? Is there an overdose level?
What is ketamine? So, a lot of people in psychedelics will say, well, I'm not interested in ketamine because I only like plant medicine, and ketamine is, synthetic. And so, what I like to tell people is ketamine is actually a crystal. And it's a crystal that's made from some minerals that come from the ground. And actually, on this planet, there is nothing synthetic. Like even petroleum came from the ground. Like there's, we're all made of material that came from space. And anyway, that's a whole other discussion. But in essence, ketamine is a crystal. And it is made in a lab. And one, positive aspect of that is that the ketamine crystal is the same every time. So it's unlike ayahuasca brew that is going to be different in every, village that brews it and has the energy of the person and has the different minerals from the soil where it was grown. This ketamine crystal is very uniform. And I don't know if you were listening to Zappy's talk earlier. He was talking about the future of psychedelics and frequency medicine and how you can, program crystals with a frequency. So like I'm wearing this patch that it has electrical wires with crystals inside, and the crystals are charged with the frequency of psilocybin mushrooms. So I'm actually, doing a microdose today, and this has no ingredients. So I just like to remind people that like the quartz in your watch is a crystal, like the silicon chips that run your phone and your computer are crystal. Like crystals hold information, and this ketamine is a crystal. So for people who don't like that it's not a plant, maybe you'll like that it's a crystal. And then as far as the cost goes, I'll also answer that, which is at this time, ketamine is not covered by insurance in most cases, although I'd love to hear from you guys. Sometimes I think clinics find a way to get around that. And so a lot of places do offer payment plans and subsidized plans. And our company, KetaMD, that offers at-home treatment, because we don't have the overhead cost of a clinic, we're able to keep the cost a lot lower than clinics. But in many cases, having a treatment in a clinic is better for people. So I just want to hear from you guys on the cost. I think that is an important question that people often have.
Well, what is the cost for mobile?
So with KetaMD and many of the at-home treatments, the cost ends up about $200 per treatment. Usually the Yale School of Medicine standard protocol for treatment-resistant depression is 6 treatments in a row, followed by booster sessions as needed. So that it works out to about $200 per treatment if you do it that way. And then usually clinics, they have a much higher overhead. So let's hear.
Kaya, is that with what delivery?
Oral ketamine.
So lozenge?
A lot.
Something?
Yeah, so it's different. So maybe each of you could take that.
Yeah, well, Dr. Harris has been doing this a lot longer than me, so he probably has a much better understanding of the range of costs out there. But in our clinic, a single IV session is $650, and if you do a series of 6 altogether, we charge $3,000 total. So that's a pretty simple, and then of course when they combine different modalities, is the same. But we also have set up a monthly program where they can do once a week sessions, and it actually makes a lot less expensive, about $400 per session.
Thank you for that question. What we also have to look at in terms of when we talk about per session is, and you're right, a lot of clinics, it's just like sort of, here's some ketamine, like we were saying, good luck. So you really are getting the just cost per infusion. What Dr. Kong and Dr. Covering and yourself are saying is that, really we should be looking at this as a combination approach. And so breaking it down by per infusion might be a little bit confusing when there's other things going on at the same time. Like, for example, the constant, direct contact with your own doctor, the 5 integration sessions that are occurring at the same time, the CBT, the mindfulness, things like that. If you were to break down our cost grossly, so for a 1-hour ketamine infusion, and we actually have 6 different protocols. So there's quite a range: 2 for mood, a 1 and a 2 hour, 2 for pain, a 2 and a 4 hour, and 2 for substance and alcohol abuse recovery, a 2 and a 4 hour, with or without adjuvants like NAD+ and things like that. With all those programs being integrated, the 1 hour dividing the 6 treatment days just by 6 would be about $700, but that's also including all those other things. So, I think that the value is still there, but I agree with you 100% that especially for the population, most people do have insurance. They are paying for this every month, and when you're seeing the kind of results that we have a 35 or 40% antidepressant benefit versus anywhere from a 70 to 85% benefit from the right kind of ketamine approaches. It really, the evidence is there. And really what it is now is sort of overcoming the innate inertia of, the very powerful marketing financial forces of the pharmaceutical and insurance companies, and also educating. So hopefully we will be able to bring that cost down by activating the insurance benefit. We actually are providing a service for our clients where we hire an actual billing team that will code their own super bills. and then submit them to their insurance companies. And what we're seeing with specifically time-based billing strategies is we are getting people about anywhere from 30 to 60% back as an out-of-network reimbursement, which is very helpful.
So, what you said. And we've had a couple patients with some very high quality insurance that actually did get fully reimbursed, including their boosters, and we've had one workers' comp case get completely covered. She has this very complex PTSD. We also are generating super bills for patients, and they are getting reimbursement for the psychotherapy piece. And our per session, when you break it down per session, is $650.
Wonderful. I love hearing how things are starting to shift and we can get creative with getting insurance companies, to cover this. One thing that Zappy says, is as powerful as the pharmaceutical companies are, the insurance companies are actually more powerful because, they want to save money. So unfortunately, I know there are more questions, but I'm being told we have to wrap up. So just a huge thank you to these incredible panelists. And if you could each just tell us, I think each one of you is giving a talk today. Just quickly tell us where we can hear you.
I think the talk is here. Is it here?
Yours is here. Okay.
Yeah, it's 1 o'clock.
Okay. Wonderful. Okay.
Is it posted?
Yeah.
And sorry, back to her point.
Absolutely.
And where can people find you and find out more about you?
Oh yeah, so my clinic is in San Fernando Valley. It's called Uplift Longevity Center, so Uplift with a Y. So you can look online, upliftcenter.com.
Okay, thank you.
I also have a YouTube channel, Joy Calling MD. I have a lot of interesting videos there if you're interested. So.
We are interested.
Hi, you guys have been great. Thank you so much for your patience and attention to this important topic. The talk that we'll be giving, I believe it's directly after this, is on integrative ketamine strategies in the treatment of substance and alcohol abuse recovery. And I think that really is sort of a frontier that has been theoretical in the past, but we'll talk about the strategies that we're actually putting in place, and the results are truly incredible.
Peter, are you on the stage?
Yes, I think we're all going to be down here, and you can find our clinic is Neuro Relief Ketamine and Infusion Therapy. We're in Sherman Oaks. Website is neuroreliefketamine.com.
Thank you.
Also, thank you so much. I'm so happy to see such amazing interest in this. I will also be speaking right here. I'm following Dr. Harris. My business is All Psychedelic Health, and we have